Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. This week, I have both hopeful and concerning news. As you know, the triple-demic of RSV, COVID, and influenza has waned, with cases of influenza dramatically and thankfully lower than earlier this fall. Over the last week, it's also clear that our wastewater signal for COVID-19 has decreased substantially in York Region and across the GTA from the peak that we had seen before and throughout the holiday period. Hospitalizations due to COVID are most modestly decreased, but not nearly enough. In fact, one of the most significant challenges we continue to face is that when transmission, cases, and hospitalizations do decrease somewhat, with each subsequent wave, they don't go down as far as they need to. This results in a chronic and ongoing strain on our acute care resources, our hospitals, and our healthcare providers that, as we all have seen, is unsustainable. The more concerning news, of course, is the new Omicron subvariant circulating in our communities and across Southern Ontario, named XBB 1.5. The variant is well known in other parts of the world, particularly in the US, and is now rapidly outcompeting other variants in Ontario and York Region. XBB 1.5 is known to be more transmissible than all previous variants, and we worry that this will mean a reversal of the positive trends I mentioned earlier. While illness from XBB 1.5 may not be as severe for most people who are immunized and have had COVID, the degree of transmissibility remains high, and this means that numbers overall will be high and more severely ill people needing care. There are actions that you can take to make a difference for yourself and the community. XBB 1.5 is more immune evasive than previous variants. This means that previous infection and vaccination will not protect as well against infection. But we do know that the bivalent vaccine and hybrid immunity does protect against severe infection, hospitalization, and death. We also know that this immunity wanes fairly quickly, certainly after 6 months. This new XBB 1.5 strain is a sublineage of the BA2 Omicron variant. The bivalent vaccine provides protection against severe outcomes for Omicron variants, so it is critically important that everyone, particularly those who are older, but really everyone, get the bivalent vaccine that is Omicron specific. If you have not had COVID vaccine since the new bivalent booster became available in September, please book your dose or walk into our convenient and accessible York Region Public Health clinics as soon as you can. Visit york.ca/COVID-19 vaccine or call Access York at 1-877-464-9675 or just show up. We are planning on increasing our mobile clinics as well, so check out the website for a site near you. The bivalent vaccine is now available for kids aged 5 to 11, so everyone 5 and up has access. Almost half of those over 70 years old have received the bivalent vaccine, which is great, but that still leaves a large number of people at increased risk. Protect yourself and protect those who are most vulnerable, and protect against yet another surge in hospitalizations by getting vaccinated. It is still important to stay home if you have symptoms, if you're able to, even if they seem mild like a runny nose or a tickle in your throat. If you really can't remain home, please wear a mask if you're out in public. I want to wish all those celebrating the Lunar New Year a happy and healthy New Year. Please continue to celebrate with COVID sensitivities in mind. In particular, please respect those who choose to wear a mask or celebrate in smaller gatherings. I'm hopeful that if we can increase our bivalent vaccine coverage across the entire population of York Region, and if we can continue to be responsible with personal and community protective measures, we will make it through this current variant and move towards a more hopeful and normal spring.